Welcome back to Healthcare Administration 101 from Wealthcare. In the last episode, we talked about healthcare quality and why it matters for performance. In this episode, we are shifting into another core part of the business of healthcare, claims processing. Claims are one of the most important bridges between care delivery and payment. A patient may receive care, a provider may document the visit, and a healthcare organization may do everything clinically right. But if the claim is not created, submitted, and processed correctly, payment can be delayed, denied, or lost. So what is a healthcare claim? In simple terms, a claim is a formal request for payment. It tells the payer who the patient is, who provided the care, what service was delivered, why it was needed, where it happened, when it happened, and how much is being billed. Claims can also come in different formats depending on the type of service. Professional claims are often associated with the CMS 1500 form and are commonly used for provider services. Institutional claims are often associated with the UB04 form and are commonly used by hospitals and facilities. Today, most claims are submitted electronically through 837 transactions, such as 837P for professional claims and 837I for institutional claims. The format may differ, but the goal is the same. Give the payer the information needed to review the service and determine payment. The claims process starts before the patient even sees the provider. It begins with patient registration and insurance verification. This is where the organization confirms the patient's demographic information, insurance coverage, member ID, eligibility, benefits, and whether a referral or prior authorization is required. Next comes the patient encounter. The provider delivers care and documents what happened during the visit. That documentation supports the services billed and helps explain the reason for the visit and why the service was medically necessary. After the encounter, coding and charge capture come into play. Coding translates the visit into standardized diagnosis and procedure codes. Charge capture makes sure the services provided are properly recorded for billing. Then the claim is created and submitted to the payer. A claim usually includes patient information, insurance details, provider information, diagnosis codes, procedure or service codes, dates of service, place of service, charges, and other required details. Once submitted, the payer begins adjudication, which means the payer reviews the claim against coverage rules, contract terms, coding guidelines, medical necessity requirements, and the patient's benefits. Once a claim is reviewed, it can be paid, denied, or rejected if details are missing or wrong. A balance might remain for the patient due to copay, deductible, or coinsurance. This is why clean claims are crucial. They have correct information, follow payer guidelines, and avoid errors. Clean claims ensure faster payments, less rework, fewer denials, and better cash flow. Problems with claims can happen anytime, highlighting the role of healthcare administration and revenue teams. Front office teams gather correct information. Eligibility teams confirm coverage. Clinical teams record the visit. Coders turn documentation into precise codes. Billing teams send claims and do follow-ups. Denial teams address issues and find patterns. Leaders analyze data to pinpoint process breakdowns and solutions. Common claim issues can happen at many points in the process. Incorrect patient or insurance information can cause a rejection. Missing authorizations or referrals can lead to a denial. Coding errors can create payment problems. Documentation gaps can make it hard to support the service billed. Medical necessity issues can cause the payer to question whether the service should be covered. Timely filing problems can cause organizations to lose payment simply because the claim was not submitted fast enough. Coordination of benefits issues can happen when more than one payer may be responsible and the claim goes to the wrong payer first. Leading organizations address claims issues early by examining the root causes and upstream processes. Missing authorizations may highlight a problem at the start of the workflow. Documentation gaps might mean providers need guidance or better forms. Insurance errors point to a need for better registration processes. Claims processing links to many healthcare areas. It affects operations as errors can slow payment. It influences finance since claims are key for revenue. It involves compliance as billing must adhere to rules. It impacts quality because accurate data shows care and performance. Finally, it affects patient experience since billing issues can cause frustration. So the big takeaway is this: healthcare claims are more than paperwork. They're the pathway that turns care delivery into payment. Claims connect documentation, coding, payer review, reimbursement, operations, and patient experience. In the next episode, we will simplify health insurance, focusing on coverage, benefits, networks, and more to understand the healthcare journey. For straightforward insights on healthcare, subscribe to Wealthcare Inc. Thanks for watching.